To get started, we have three speakers today, and then we'll go to some community members who will be talking about the census in their area. First up, we have Senator Tom Udall. He will be followed by Pam Coleman, who is the chair of the state's Complete Count Commission, also the director of the New Mexico State Personnel Office. Followed by her will be Dennis Johnson, Deputy Regional Director for the U.S. Census Bureau. So with that, I will go ahead and kick it off to Senator Tom Udall.
Okay, Olivia, can you hear me?
We can hear you.
Great, thank you so much. And just hello to everyone here. Safely reopening Southern New Mexico Census Office is really a cause for celebration. And we just got good news later. Northern New Mexico office in Albuquerque will be resuming their field operations June the 1st. I can't emphasize enough how critical an accurate count is for the state of New Mexico. If we miss just 1% of our population, New Mexico can lose more than $1 billion. And that $1 billion will be lost over the next 10 years. And that's billion with a B. That's big money. New Mexico simply can't afford to miss out on our fair share of these federal dollars. The stakes are high without a complete count. And I just wanted to give you an example of what we could be losing if we don't get an accurate count on the census. Medicaid funding that keeps New Mexico families healthy. Title I dollars that help give our children a good education. That's hundreds of millions of dollars. SNAP and free and reduced lunch funding that puts food on family tables and provides nutritious meals to school children. Head Start money that starts our kids off on the right foot, and funding for small and minority-owned businesses that help fuel our economy, and so much more. That's just a start on the list. While getting an accurate count is imperative, New Mexico is one of the most vulnerable states because of an undercount. And because we are undercount, we have a harder to count population. We have rural residents, we have immigrants, Latinos, Native Americans. Last year, Senator Heinrich and I invited the director of the Bureau, Steve Dillingham, to New Mexico so he could see the challenges we face here firsthand. He committed to meeting those challenges. We not only have harder to count communities, but nearly 20% of New Mexico households rely on hand delivery of their census forms, one of the highest rates in the country. The Southern New Mexico Census Office is tasked with delivering over 56,000 census forms across 15 counties to people's doors. That takes a lot of resources to get that job done. And I worked hard on the Senate Appropriations Committee to make sure that the Census Bureau has the resources to get the job right. Getting these forms delivered is a big reason reopening the office is so critical. But it's important for the public to know that the census workers delivering these forms have been trained to follow public health guidance to protect against transmission of COVID-19 or the coronavirus. They'll be wearing masks and gloves, will be social distancing, and won't have direct contact with residents. They simply drop off forms on people's doorsteps. It's also important to understand there is no, and I underline no here, citizenship question on the census. I fought hard against that. All information on the form is kept completely confidential, and there are many ways to get counted. The census can be completed by mail, online, and over the phone. I filled out my form online, and it only takes about 10 minutes. Finally, I know that the impacts of the coronavirus weigh heavily on all of us. In Washington, I remain focused on improving our public health response so that we can reopen safely and keep working people, families, small businesses, and vulnerable populations healthy and financially secure. And now I'd like to turn it over to Pam Coleman. Pam is the chair of the statewide Complete Census Count Commission. Thank you.
Thank you very much, Senator Udall. It's wonderful to see you. It's wonderful to be included on this town hall. As the senator said, I'm the director of the State Personnel Office. That's what I've been doing since January of 2019 here in New Mexico. And recently, and in fact, today is my 1 week anniversary as the chair of the statewide Complete Count Commission. And what I've seen in my short time, not only being the chair, but also being a big fan of what organizing happens at the county level on the census, is that the passion and persistence and dedication to making sure that each of our precious New Mexicans is counted in the 2020 census could not be more paramount. As the senator described, and as we're all living through right now, the COVID public health emergency has sidelined not only what business is doing, what's happening in our homes, our social distancing in our schools, but also has put a pause for the door-to-door US Census work. Happily, as the senator has just described, those door-to-door contactless, to be clear, no one will talk to you at your door, but the going and dropping a packet of your census to the folks who have not yet received a census packet is happening right now. The Las Cruces Area Census Office opened a week and a half ago. The Albuquerque Area Census Office just opened on Monday, and the Update Leave program, which is going to each household and dropping off a census invitation, is happening now. The 20% of New Mexicans who do not get their mail delivered to their home and get it from a post office box, those are the folks who have been waiting to receive their census packet. As our counties have focused their time and attention on making sure that anybody, as Senator Udall did, got his census form and went online and returned it. I did the old school way. I completed it in 10 minutes and put it back in the mail. Whichever way you return your census form is okay with the US Census and is okay with New Mexico, because at the end of the day, at the beginning of the day, this is all about achieving a count of New Mexicans, no matter where you live, no matter what circumstances you're in, whether you are a citizen or not, it is immaterial. You are a New Mexican and you must be counted. Thank you, Senator, for your passion about figuring out appropriation that's going to make sure that we have the census fully funded. And I am very pleased to pass the mic to Dennis Johnson, who's the Deputy Regional Director of the US Census in the Denver region. Thank you.
And thank you, Director Coleman. Thank you, Senator Udall. I trust you can hear me. I also want to thank all of our great partners in the state of New Mexico. The continued support we've had before the pandemic, during the pandemic, the continued support has been tremendous, and we appreciate that. And I can assure you that we are excited to restart operations. We all took a break for safety reasons over the last few months, but we are excited to get back to work. We've been working very closely with federal, state, local officials, health officials, and we combined information from all of those sources as we replan this restart of activities. And as has been said, we've restarted in Las Cruces in the office and across the southern part of the state, and very, very pleased that the Albuquerque office is open again and starting operations as soon as we possibly can. And I can tell you, we're also in very close contact with the leadership on the Navajo Nation. We're hoping to resume operations in that part of the state as soon as we safely can. That's a top priority. As was stated on March 18th, we suspended one of the major field operations. And Director Coleman, you spoke to that. Because of that suspension, we were unable to complete the delivery of about 20% of the questionnaires across the state. We are resuming that operation now in most counties, which means virtually all residents over the next few weeks will have the information they need to complete the census accurately. This also means that the state of New Mexico will be fully represented when the information is compiled next year. Now, even though we've resumed operations, we have changed things somewhat, and you referred to those, Senator Udall and Director Coleman. We've taken some precautions so that members of the public and our own census workers who are New Mexico residents are safe, and they remain safe. There's no need for workers to make contact with the residents. We verify the location of each household. They leave a questionnaire package. It has a code which allows that household to respond accurately and securely to the census. And for the most part, this is being done in the more rural parts of the state. But of course, everyone can continue to respond to the census for their own household. In the 2 offices in New Mexico, our workers are going to be rotating into the office so that we monitor the number of people gathered at any one time. Again, we're providing them with masks and making sure that everyone will continue to be safe. And we will follow any local guidelines that may be in effect regarding safety and PPE. And I can tell you currently there are over 600 New Mexico residents that are working for the census. They're helping to ensure a complete count across the state. That number will expand many times as we continue our operations late summer and early fall. We're also have about 3,000 local organizations, governments, individuals that we proudly call our partners. And they've been working to get the message out about the importance of the census. All 33 counties are represented in that. Our goal is to make sure every household gets the message about how safe, how important, and how easy the census is. As of today, nearly 48% of all households have already responded to the census. And as we complete the task of delivering questionnaires to that remaining 20% of the households, we expect that number to shoot up very quickly. So we are truthfully looking forward to that. So residents of New Mexico, not only in each household, are working hard, but also the employed workers of New Mexico are working hard to ensure that the state and all of the communities get their fair of representation, their fair of funding. And remember, it's not just this year, it's for the next 10 years. Answering the census will take care of that. And with that, I'll turn it back to Olivia.
Thank you, Dennis, and thank you, Pam and Senator Udall. Next, we'll turn it over to some community members who will be speaking about how the census impacts their specific professional areas and their day-to-day lives. First up, we have Arsenio Romero speaking about education in the census. He's a superintendent at Deming Public Schools and member of the NMSU Board of Regents.
Thank you for having me here today. I'm very honored to be here this afternoon to be able to talk about how important the 2020 census is and completing this. I did it online, and I want to just verify it does only take about 10 minutes. Not hard at all. It was very easy to do. I'm really excited to talk about how this impacts our most precious resource in New Mexico, in my mind, and that's the students of New Mexico. Whether you're a pre-K student, whether you're a public education student, or you're going into higher ed and college, this impacts you. So I'm gonna put a few numbers to this. Did you know that most young children, 80 to 85%, who were missed in the 2010 census count, they lived in households that completed the census. So it's really important that we make sure we count those newborns and those 1-year-olds in that count. It's also estimated that if we just have a 1% undercount of children that are under 5 years old in New Mexico, that translates into over $38 million in a loss in federal funding. Now, let me talk to you about how it helps. In 2018, almost 10,000 children and pregnant women in New Mexico were supported by those federal funds for Head Start programs. Now let me move into public education. These are our kindergarten through our seniors in high school, 18-year-olds. Let me put some numbers how this affects those students during their career in public education. The National School Lunch Program alone in 1 year, $101 million goes into funding for these students. School breakfast programs, $45 million in just 1 year. Head Start programs, $83 million. Federal student loans, these are students that are getting ready to move into the higher ed side of things. $280 million going to our students here in New Mexico. Special education grants, and I'm a father of a special needs student. $200 million to be able to support those programs. Pell Grants, $171 million. And this is an area that very much supports our area right here in Deming and Luna County. Because of our need, our Title I grants coming right directly to our classrooms, going directly to kids, $127 million a year across the state. Now let me go over to the college side of things. These are our students that are moving into the universities. There's a few questions about what happens if you are a student in a university and how you should be able to interact and complete the census. College students that normally live at school should be counted by their school. So that's a question that we get quite a bit. And if you're temporarily living somewhere else because of COVID-19, still allow your university to count you there. If you live in the dorm rooms, you're going to be counted by the school. If you're a student that lives off campus, you're going to need to make sure that you count yourself, okay? I want to just end by saying that to make a difference, you can do this for your schools, for your students, for your communities. The 2020 census has a tremendous impact on our local communities. Special education, Head Start, after-school programs, and classroom technology can all be affected by the 2020 census. School lunch programs and child health programs are also impacted by the census. If we don't get this right, children will go most of their public education career without the tools that they need to be able to be successful. So please be bold, be amazing, and complete the 2020 census. Go Aggies, go Wildcats. Thank you.
Thank you, Arsenio. I appreciate that. I'm a Lobo myself, though, so hey, go Lobos. Up next, we'll have Megan Mooney. She'll be talking about some of the infrastructure that's supported by census data. She is the chair of the Lee County Complete Count Committee and director of communications for the city of Hobbs.
Good afternoon. I am the chair for the City of Hobbs Complete Count Committee, but I do serve on the county's Complete Count Committee, practically a co-chair. So thank you all for having me this afternoon. It is so great to see so many faces of this many partners coming together during such a unique and challenging time to work even further together in yet another creative way, just the way that New Mexico does it. Thank you to Senator Udall and your office for the opportunity and for coordinating this. I appreciate the opportunity to speak on the 2020 census and the time given to such an important matter, which only comes around every 10 years. The data collected on the census affects every individual in their work, their school, and their everyday lives, just as we're hearing from each of us in these different areas. The city of Hobbs lies in Lee County, and from the southeastern region of New Mexico comes a larger portion of the state's budget than any other region. A 1% undercount on the census will result in over $11 million lost in Hobbs and over $20 million in Lee County. In Lee County, we hold the nickname, thanks to the successful energy sector in this area, the Energyplex. In Lee County, the quality infrastructure is a critical element to a thriving oil and gas industry and overall successful energy sector. We love this area and we love this state, and most of all, we love the people. Every single adult, child, and resident counts. As all New Mexico can relate, our area is very rural. So to put that into some numbers, in just 2016 alone, funding-wise, the highway planning, infrastructure planning and construction, we received $400 million. Section 8 housing, choice vouchers, $75 million. And the numbers go on for an overall $589 million in 2016 for infrastructure alone. If Each and every one of us filled out our census, our community would have safer roads on which our workers and families travel. When we complain about bad roads, potholes, poor education, a lack of infrastructure, narrow options for healthcare, et cetera, in rural New Mexico, what we're really saying we're not happy with is the results we received on the last census. Quality infrastructure, including safe roads, is critical for the southeastern counties of New Mexico, as well as all of New Mexico. We had too many fatalities on the roads of the Permian Basin last year, and that is largely due to unsafe roads with a lack of funding. These are our neighbors, our parents, our siblings, and friends on these roads. Whether you work in the energy sector or you're traveling through this area, it is a risk. Quality infrastructure is both a matter of quality of life and most importantly, a basic to supply community members with safe methods of travel, water, lighting, and so much more for our businesses and residents. We hope to reach 50,000 in Hobbs on this year's census. At that will put us in a whole other bracket to receive state and federal funding for our community, business members, and residents. Together, we can make sure the current pandemic does not hold us back and we all reach our goal. The City of Hobbs appreciates all the efforts and coordination from the State of New Mexico and the U.S. Census Bureau, and of course, Senator Udall's office. Thank you for your time. Now let's make all of New Mexico count. The Permian counts.
Thank you,
Now
Megan.
hand it off to Dr. Neblett.
Thank you, Megan. Next we have, we apologize for that. Dr. Edwin Neblett. He'll be talking about senior programs, and he's a retired primary care doctor in Catron County. So Dr. Neblett.
Thank you for having me on. As you know, Catron County is the largest county. Half a person per square mile. That makes it a challenge for the census. I have to tell you, it makes a difference because I'm one of that 20% that does not get mail delivered to my house. So I, like Dr. Romero, did mine online. I did it for the whole family. I didn't wait for them to do it. I took care of it for them. Nevertheless, the reality of it is that this is crucial to us because, as you already know from the census.gov, we know that 27% of seniors living in New Mexico are living alone, and that 13% of the population of New Mexico are seniors. Not in Catron County. 32% of the population are 65 or older. And so the challenge that we're faced with is not only getting a census form to them, but having them fill it out. That's the critical part for us as well. Now, we have the privilege of being involved, at least I have been, in the last 21 years that I've been here in the county. For a while, I was the only physician in the entire county. Now we have two others. And what happened is that we have been involved on all levels of care for our seniors, including with Presbyterian Medical Services, involved in senior care. Now, as you know, the census dollars make a difference because $265 million in Medicare dollars came to the state for just talking about healthcare alone. But even so, there are a few seniors who can afford Part D to pay for the medication that they have. But because we have rural healthcare here in Catron County, they're able to get their medication much more affordably. Now, the reality of it is that we are thankful for the state of New Mexico because even with the federal dollars, it's not enough. It would be better if we had more, and that depends completely on that count. The goal of services is not just to assure that seniors have access to nutritious meals, which you can do, we are doing, but not having them come in and congregate, because socialization is important. We just have to adapt to the current times, but we still are able to give them a nutritious meal delivered to their home. This would not be possible unless we had the funding to make this happen. So my appeal to all of our census, those who are taking the census out there and dropping it off, is to follow up with them and make sure they've done it. Because to not do it is the same as not having had it. And for us, we know that this makes a big difference. Senator Udall pointed it out. We're talking billions of dollars per percent not counted. That's a big, it's a vulnerable population. And we know it, and we have got to take care of them. These are people that we treasure, that we care about, and the only way for us to do it is provide the funding to help take care of them. So Thank you for those of you who are encouraging the census to be taken, and it's up to us to make it happen. Thank you.
Thank you, Dr. Neblett. That was great, great speech. And Catron County, incidentally, is actually one of the hardest to count counties in the nation, not only in the state, but in the nation. So we definitely need to put some additional focus there on a state level.
It's not because we're rebellious, but it's because it's hard to get to us. We are scattered, and that's the reality.
Exactly. Well, thank you so much for sharing. Next, we have Annabelle Canchola. She will be speaking about the colonias and hard to count communities in southern New Mexico. She's a certified community health worker and a program and contracts administrator at Doña Ana County. Did we lose you, Annabelle?
She appears to still be muted.
Can you hear me now?
There we go. Thank you.
Can you hear me now?
We can hear you.
Great. Thank you for having me here on this very special announcement. I was on the phone, called in. Again, my name is Annabelle Canchola. I do work for Doña Ana County Health and Human Services for many years, and I'm also a certified community health worker, otherwise known as a promotora de salud. In this current time of social distancing, I came across a college student who resides in a colonia, so we do work outside of the city limits, a lot in rural areas. And what I found with this college student is that he didn't have access to affordable internet. With the closure of college campuses, classes were shifted to online classes. And in order to access the internet, to continue his online classes, he would sit outside a public building to access the free Wi-Fi signal. After being approached by law enforcement, even Border Patrol several times, he reached out to a promotora for help. How can he access internet if all the buildings are closed? He didn't have the money, neither did his family, to purchase internet. So he was then referred to me. I was able to do some research and assist him and his family and connected him and applied for the Lifeline federal program, which is a federal benefit that lowers the monthly cost of phone or internet service, and also to an internet provider that reaches the area, because he lives in a rural area where there are no cable lines, and there wasn't yet a phone line, which he can, through CenturyLink, which is going out to that area, can provide. This student now has been able to complete his classes, and it improved his and his family's outlook, considering accessing internet was a crisis and it was affecting them all. He wasn't sure whether he was going to be able to complete his classes. This is why federal programs such as Lifeline help people like children, students, the disabled, the elderly, and are especially important to support them during these difficult times. These programs are so critical now more than ever. At county community centers located in the colonias, we have served as a resource hub for helping people seek and access social services. A lot of federal programs, staff offer these resources and referrals, like wraparound services ranging from public health clinics that have WIC and prevention services, income support services for Medicaid, TANF, SNAP, LIHEAP, and of course Lifeline services, and of course the federally qualified health clinics that are located throughout the county for medical, dental, and behavioral health services, all of which are impacted by a complete census count. We also explain the importance of completing the census in order to provide more benefits to growing communities. Educating residents in hard-to-count areas in the colonias about these federal programs allows them to stay in their communities. It enhances their lives and supports their heritage and strengths for their families. As a promotora de salud in the colonias, we are addressing cultural and linguistic barriers. We act as interpreters to help explain how to access these federal benefits. And we want to make sure that our community members will continue to have access to these benefits for the next 10 years. By responding to the census, we're showing that there is a need for community programs, support, and services, just like the college student who needed access to the internet. When we show that we are here and we deserve to be counted, we ensure that we'll get the resources we need to live happy and healthy lives at home.
Thank you, Annabelle, and thank you for sharing that story. Next up, we have David Briceño. He'll be speaking about healthcare. Which have clinics in Portales, Clovis, and Roswell.
Good afternoon. Again, thank you for this wonderful opportunity to share our passion for the work that we do and the importance of a complete census count in 2020. And as you shared, my name is David Briceño. I do work for La Casa Family Health Center, and we're fortunate and we serve those 3 counties in East Central New Mexico. But we are one of hundreds of community health centers across the nation that save lives and health dollars. And in some New Mexico communities, we are the only access point for medical, dental, and behavioral health care. Like the rest of you, I've already completed my census. In fact, I did it the first day, got online, wanted to see what it was all about. And in 5 to 10 minutes, I was done. And I said, hey, this is easy. Let's make sure everybody else does this. We are active members of the complete count committees in each of the counties that we serve. And in those communities that we provide those services. And here's what we do know, that the data that we receive from the census will be used by us and by others to plan for current and future needs and to ensure that New Mexico receives the federal dollars needed to meet the needs of those living in poverty and the uninsured. In 2016, 414,277 children in New Mexico relied on Medicaid and CHIP to access the medical, dental, and behavioral health care they needed. 47% of all Medicaid and CHIP enrollees in New Mexico are children. We also participate in what we call the 340B pharmacy, because what good does it do to access primary care if you're not able to then purchase the prescription medications that have been prescribed to you by your physician? So the 340B pharmacy is another federal program that allows us to purchase these prescription drugs at cost, and then pass that savings on to our patients, who can then access those much needed prescription drugs such as insulin, other life sustaining prescriptions that they need. So that's a very, very important piece. An accurate and complete census count equates in federal assistance dollars for those most in need. For example, in 2016 in New Mexico, we received 4.3 billion Medicaid dollars. That's huge. And we were very fortunate to be able to be part of that expanded Medicaid program. And so more of our citizens were able to access that. Thank goodness for that. And community health centers like La Casa received 69 million. There's like the other community health centers you have in Doña Ana County, or those that exist in Catron County, or other counties throughout New Mexico. We are part of that system. The Children's Health Insurance Program brought in $122.5 million to New Mexico. $693 million was received to support the Supplemental Nutrition and Assistance Program. That's crucial to maintain the health of our citizens, that they're eating healthy and doing what they need to be doing. So this is all part of building the health infrastructure. Hospitals depend on it. I know that probably our learning institutions that have medical schools also depend on these federal monies. Now, as La Casa, we also partner with others. And for example, we provide transportation and social services to seniors in Portales and in Clovis, transportation to medical appointments, that kind of thing. That's critical for those seniors who no longer drive and maybe don't have anyone to get them around. We have partnered with the Food Bank of Eastern New Mexico and assist with food distribution in Portales. They get much of their assistance from the USDA. Again, federal monies coming into our communities to provide much needed assistance. Each summer, we are the sponsors of the Summer Food Service Program in Clovis and Portales, and we serve over 5,500 meals daily to children in those communities. That's huge. And our budget this year is over $500,000. Much of that money stays in our community through the salaries that we pay to those who serve, who cook, and prepare the meals for the children. So that's a little bit of a stimulus for us. And you know, so I know that I spend a lot of money in these communities, so that's huge for us as well. So here's what we know. A complete 2020 census count will provide New Mexico with the support we need to continue to provide quality medical, dental, and behavioral health care to the families, and most importantly, to the children of New Mexico. So let's make sure that we stand up for us, for our children, stand up for our families, and let's be counted. It's not hard at all. We're ready to help. We're ready to assist. So get online, do what you got to do. Make sure we're all counted.
Thank you, David. I appreciate that. Before we question has any remarks, and then we can begin doing the question portion.
Great, thanks, Olivia. You know, all the people that talked today, after I did, from Pam Coleman to the long that we have there, really emphasize the incredible importance of the census. You know, it's important in rural areas. It's important in urban areas. It's important to seniors. It's important to young people. It's important to medical centers. It's important to people on Medicaid. We can't emphasize how important it is. And so thank you so much. I know all of you on this call are very, very busy. You're doing wonderful work. I was just inspired by hearing you. And so thank you for helping us get that count and help New Mexico get what it deserves. Thank you, Olivia, and back to you.
Thank you, Senator Udall, and of course, thank you for all of your work lifting this up as well. At this point, there are no questions in the chat box, so I will just leave it open for those on the call or joining via computer to ask questions. Seems like no one's taken the bait. I'm sure there's got to be a question or two out there.
Yeah, I'll ask a question, Olivia, of Dennis Johnson. What can we do, the individuals who are taking out the census, what can we do to follow up to make sure that they have done the census? In my county, given the fact that 1/3, 1 out of every 3 are 65 and older, internet, they may or may not understand it. They don't know what it's like to get online. What can we do to encourage them to do the census? What can we do to support them? I guess that's the bottom line question.
And thank you for the question. We actually have an entire operation that's designed to follow up, and it's called non-response follow-up. And that's one of the things we can do. Of course, we would prefer that people respond online, over the telephone, or with their paper form. But if they're unable to do that, we hire a host of local workers to actually go to their door, talk with them to complete the information, assist them in completing it. And again, it's done safely and securely, and we make sure that they're counted. As the responses come in, we keep track of which households have responded and which have not. So we can follow up with those households and take care of any needs they have. For example, language needs or other needs they have that's prevented them from responding at that point.
That is good to know. Thank you.
Olivia, could I just say a word there?
Yeah, of course.
Yeah. Mr. Neblett, you really raised a very, very important issue. You know, for everybody on this call, you have the people that are specifically working on the census, but then you have everybody else out in the community. And between now and October 31st, any public meeting you're in, any exposure to the public, all of you have such positive stories. You can just have a little pitch like you did today. You know, I was on this call and I learned how much the census means to New Mexico. And make sure that all of you fill out your census. And if you have a problem, we'll get you in touch with somebody to make sure that it can get done. So we just need everybody engaged in this. And so the census, as the fellow Dennis up in Denver, he's working hard. Pam Coleman's working hard. They're doing this every day. But all of you that are out there that aren't doing it every day can still encourage people in the community to do everything they can. Thank you.
And if I might, Olivia, just to piggyback one more time on the senator's excellent advice, which is when we get asked, I've already filled it out, you know, I'm done. It is to become a census ambassador. If you can, or a census evangelist, when you learn the extent to which we would receive or not receive federal dollars by virtue of one person not being counted appropriately, this is an opportunity to talk to your friends and your neighbors. And as the senator said, anyone who will care to listen. We are working with the local complete count commissions, Dr. Nesbitt, as you know, to make sure that we follow up with phone calls, with opportunities at the grocery store so people can see like, oh yeah, I have to remember my census. The fact that the census offers not only an online version, which can be very challenging with the lack of broadband, but a phone call opportunity, and that there are broadband opportunities, to go back to Annabelle, that there are Wi-Fi spots across the state that have been set up specifically to allow people who have relied on public space to be able to go online. So I would say, as the senator said, become the person who they know. You are Joe Census, you are Jane Census, you are Jose Census. Like, it is about the census, and talking about the census is a good story. It's an important story, and it's one that we need to continue to tell until October 31st rolls around and our count is complete.
I like that, Pamela. You're talking about being an advocate. We talk about being an advocate for voting. Let's be an advocate for the census. I never thought of it that way, but you're right. I finished the census and I figured, okay, my job's done. No, it's not. Good point.
I just wanted to add, and I forgot to mention it while I was speaking, but the census is available in multiple languages, so that should not be a wall to keep people from completing that census, because all they have to do is you know, if they speak Spanish, it's available in Spanish, and I don't know how many other languages. I think 32 or something like that, or maybe more. But that should not be an excuse not to complete the census.
Great, thank you all. It looks like we have one more question, and then I will leave our contact information for further follow-up questions from media outlets.
Hi, this is Jeffrey Plant with the Silver City Daily Press. I have a question for Pam and Dennis. The 2020 census was different in some ways because there was a lot more online opportunities, and people were really hoping that there would be a higher turnout, higher return rate of census forms this time around. And I was hoping that you could speak to the projected impacts that COVID-19 and the pause that happened with the census is going to have on the final count. Does the Census Bureau have any sense as to what the impacts of COVID-19 and having to delay some parts of the census, some parts of it have been squeezed into smaller timeframes? What's the expected outcome of this going to be?
This is Dennis. I think we are approaching now what we expected for an outcome on a national level. That does not mean that we're within a percentage or so. That does not mean we've done that in every area. And certainly the areas where we're just now delivering census questionnaires, we've got a ways to go. The extension of the census response from the end of July through the end of October, I think, is going to greatly increase the response, the ability for people to respond on their own. And we have not cut short the non-response visits that we will be making. That will still continue to be the same amount of time that we've applied before. So the one thing that the pandemic has done, many people were restricted to their home and they couldn't go anywhere. And they have the ability to respond to the census for the first time online or on the phone. We haven't been able to do that before. And they didn't have to touch paper. They didn't have to talk to people. They didn't have to have contact with anyone, and they could still do the census. And in that regard, the census is probably enhanced this decade over what it has been in the past. So we're very pleased with that. But of course, we'll never be satisfied. We want that response rate to go up and up and up. And I'll let Pam respond if she has any comments about that.
Thanks, Dennis, and thanks for your question. What we expect is like the whole rest of society, that understandably, everyone's life has been disrupted because of the coronavirus and the potential to contract COVID-19. That's just a fact. It is every news story, every newspaper article, every radio show. It is the story of the century, of 100 years. And that's completely understandable. It is unprecedented in nature. We have been, and I've been so proud to work and see what has happened with the county level to pivot the strategies so that understanding that the COVID has happened, that has eliminated that day-to-day, that house-to-house contact for the last, since March 18th, when those field operations, the house-to-house operations were suspended. We are not in any way taking our foot off the gas or using COVID as an excuse here in New Mexico. It is true that while the rest of the country is inching up close to the national rate, 20%, nearly 20% of New Mexicans have not had the opportunity to receive and respond to the census. So in that regard, we have had folks who maybe have it still sitting on their kitchen table. Maybe that envelope is still there, but it's not because, oh, I'm on vacation, I'll just go check out my mail. It's, oh my gosh, I'm isolated and I can't even focus on anything except for what's in front of me with respect to this potential virus. And as we allow for the folks to come out and go from household to household, as the story is transitions from all COVID shutdown all the time to phased, responsible reopening, then we're looking at opportunities where another message can come through, which is what we're talking about today. So again, in New Mexico, the folks in the counties, this is not one person I've heard is a woe is me, oh, it'll never happen. This group of people in New Mexico, as New Mexicans always are scrappy, are persistent, are relentless in making sure they're going to hit a goal. This opportunity right now to follow through on the Update Leave program, which is the house-to-house program, is where we are right now. And we're confident that we will leave no stone unturned, no pivot strategy untried in order to get everybody counted.
If I could respond to you, I think Pam and Dennis did wonderful jobs at their answers they put out, and I totally agree with them. I would say I'm definitely concerned about what this pandemic means for getting an accurate count by October 31st. But let's think about it for a second. Starting June 1, New Mexico census offices will be open, doing business, and going out and doing all the specifics that are needed. Having those offices up and running will certainly help meet the deadline. But the remaining office in Window Rock, Arizona, that covers the Navajo Nation, remains closed because of the COVID outbreak there. That's a particularly hard area to count. It's rural. Many people don't have physical mailing addresses, and census workers have to go out and find residences. There can be language and cultural barriers. This is troubling because it's critically important the Navajo population get fully counted. I'm working on that front to make sure that we do everything we can to get the virus under control so that we can do all the other things out there we need to do. Just like Pam and Dan, I believe New Mexicans are resilient. I believe they really care and love their state. And the best thing you can do if you love New Mexico is fill out that census form. Thank you.
Thank you all. I think that's a good place to end on today. There's contact information in the chat box if you have further questions. Thank you, Senator Udall and your team for hosting this roundtable. We really appreciate it, and it was a fun time. So just thank you again.